Virtual reality in real surgery. Is this the future? Today, in our modern life, we often hear that with all these gadgets and smartphones, we are forever immersed in a fake or virtual reality, virtual friends, virtual communications, virtual learning finally. And in fact, this is so true. Today, the virtual has become no less real than objective world surrounding us on the streets or at home. However, the truth is that only few can give the clear-cut definition of the virtual reality. So today I will tell you what is the difference between virtual, augmented, and mixed realities and how these technologies can be applied in real surgery. VR, or virtual reality, is an environment. It's an artificial environment that creates a realistic illusion of presence for all human senses. Moreover, the impressions from a contact interaction with this artificial environment are so complete that sometimes it's very difficult to make a difference between reality and virtuality. AR, augmented reality, and MR, mixed reality. That is, when the virtual objects created by computer-augmented technologies are mounted in a field of real environment, which means in a field of real perception. All three abbreviations, VR, AR, and MR, are associated primarily with the gaming industry. However, as it turned out later, the potential for using them is much wider, which was clearly confirmed by the current examples of application of this technology in medicine. Virtual reality in medicine, it's something that has gone much further than three-dimensional imaging. Surgeons having a 3D model of an organ or organ systems to be operated on in front of their eyes can better plan the intervention, increasing the patient chances even in the most difficult cases. So why are we talking about VR in surgery today? The advancement of VR technologies in surgery is promising for obvious reasons. In no other field of medicine, visualization of the doctor's action plays such an important role. Virtual reality can help surgeons in many aspects, almost at all steps of surgical treatment. Let's see which ones. Starting with pre-operative planning. Have you ever thought how carefully do you prepare for each surgical case? How detailed do you know the individual anatomy of your patient, specific features of this anatomy, and sometimes its variations and anomalies? Virtual reconstructions based on X-ray, ultrasound, CT, and MRI can help surgeons prepare for complex operation and better plan their actions through a better understanding of anatomy. Moreover, the more complex the anatomy, the more useful this technology is. In special virtual reality glasses, HoloLens, surgeons can see the three-dimensional images of a particular pathology, an affected organ, but more importantly, how first and second can be related to each other. Thus, virtual reality, along with 3D printing, can be used for preoperative planning. With three-dimensional information about the patient, surgeons can create interactive models to predict surgical outcomes on a human body. And the technologies of augmented reality help surgeons to get information about the whole pathological image during the surgery in real time, being the main tool for intraoperative navigation. Let's see how. On the example of laparoscopic distal pancreatectomy, the technology of augmented reality allows not only superimposing the results of virtual CT model on a real work area, which is the operating field, but also displays supporting information, the patient's medical history, vital signs, and many others. In this case, surgeon control the device using interactive hand waves and voice commands. But the technology of augmented reality allows to apply not only CT data, but any other imaging studies to the real operating field. For example, like this laparoscopic liver resection completely navigated by ultrasound. Intraoperative ultrasound, which is commonly used in HPB surgery, is not necessary in this case, since the entire surgery is navigated in a live mode by ultrasound guidance, providing a surgeon with the data on the topical anatomy of the large vessels like arteries and veins, bile ducts, and the boundaries of the lesion, which allows to perform surgery faster and safer. And how does augmented reality help as a navigation tool in interventional radiology? Here we can see the interventional radiologists who do perform their surgery using the technology of augmented reality. Using the HoloLens glasses in order to superimpose the data of this MRI to the real operating field. And this is one of the most trending topic today, since VR technology is especially popular for educational purposes. In April 2016, a neurosurgeon from a London Royal Hospital, Shafi Ahmed, was the first who offered to attend a neurosurgery virtually, in which he removed a brain tumor with a broadcast on a network. About 5,000 of people watched his surgery from the 14 countries. Now the startup he founded, called Medical Realities, launches a new product, Virtual Surgeon, in order to reduce the cost for training for doctors and to make such a project accessible in a wide audience. Subsequently, a team of neurosurgeons from London performed a surgery on a patient's open brain, recording the entire process on a camera with the effect of immersion into virtual reality. In this case, 2 cameras were installed in the OR. One of them was placed on the wall of the operating room, and the second one was placed on a surgeon's forehead in order to record the surgery from the first-person perspective. Each step of this procedure and the actions of the surgeon as a video are commented by an off-screen consultant. As the producer of the video noted, such videos can help future doctors to conduct a surgical training in virtual reality. Moreover, this video is a part of the BrainBook educational platform, which through the social media helps specialists from all over the world to get the information in the field of neurosurgery and the treatment of the brain diseases. Continuing the topic of training on virtual simulators, VR technology is used for training purposes to simulate complex surgical procedures, to simulate difficult and non-standard clinical situations and cases, and even to simulate a teamwork in a hospital. These are programs in which future doctors can practice on a digital patients in a virtual hospital, confirming that the possibilities of VR technologies in medicine are enormous. But not only students and residents, adult surgeons sometimes need training too. Remote virtual mentoring is a virtual technology that allows to train surgeons remotely. At VPAR, engineers created AR glasses that record what's happening in the OR and transmit the whole information in a live mode to a remote surgeon. And he, in turn, using AR glasses, can control the actions of a doctor working in the operating room. His hands are projected on a display of the first surgeon, while sound communication is simultaneously carried out. Thus, a surgeon who is more qualified within a given area perform remote mentoring. Interpretation of disease in upcoming surgery for patient is also possible using VR technology. So patient communications is one of the applications of VR technology. So let's go back to Dr. Wendell, a neurointerventional radiologist. So how he explained to his patients the upcoming procedures, which was subsequently performed using AR technology, as we saw on the previous slides. Do you explain to a patient like this, using sketches or drawings? Yes, we often do this. Actually, we often try to explain a certain pathology to our patient using data from CT, MRI, X-ray, and other studies. But for our patients, these are just black and white images, which are very difficult to understand. And more difficult to understand the upcoming procedure, which is planned for them. So another possibility that VR technology gives us is the use of technology to interpret the diagnosis and the planned surgery. A patient wearing VR glasses can better understand what his illness is about, and the surgeon, in turn, can more clearly explain the upcoming procedure to his patients. So the studies have shown that the patients who were educated using VR technology better understood the course of treatment along the entire process. So maybe this is your future patient to whom the diagnosis and the upcoming surgery you will explain in the VR technology. Or maybe this is the future surgeon who will operate only this way. So, will virtual reality become the future of surgery? Time will tell. Thank you.